Waziri wa Afya Mheshimiwa Senator Mutahi Kagwe, Katibu Mkuu katika wizara Madamu Chache, Dr. Kuria ambaye ni Director General wa Health, partners wote ambao wamefika hapa na wafanyikazi wa hospitali hii, hamjambo. Waziri, kwa sababu ya wakati ningetaka tu kusema kwamba NMS, Nairobi Metropolitan Services, ina uhusiano mzuri sana na National Public Hospital Laboratories, na niko na only about 8 issues to mention in that relationship. Nairobi Metropolitan Services is pleased to be associated with National Public Health Laboratory and wish to join the institution in celebrating this milestone in enrolling its 5 laboratories with the Kenya Accreditation Services. NMS has partnered with National Public Health Laboratories in microbiological, chemical, and nutritional tests of samples submitted for analysis. This strengthens our capacity to manage diseases like COVID-19, cholera, and other outbreaks in the city. NMS has a total of 120 medical laboratories, out of which 4 are accredited. That is Westlands, STC Casino, Langata, Liruta Health Centers, and 2 sites, Mama Lucy Kibake and Bagadi Hospitals. For COVID testing, we are also able to conduct rapid testing for COVID-19 in all NMS health facilities. However, NMS receives supplies of rapid test kits for COVID-19 from National Public Hospital Laboratory. Additionally, NMS is supported by partners through Ministry of Health with PCR kit. National Public Health Hospital Laboratory is also key on expanding testing coverage for COVID-19 in Nairobi. NMS has also been able to strengthen its disease surveillance system by regularly collecting samples from patients, food premises and environment, and submitting for analysis at this institution. The lab has also trained our staff on several areas, among others, particularly COVID-19 sample collection, handling, and analysis. Therefore, attainment of this accreditation will strengthen the lab's conformity with assessment services, which include calibration, product testing, medical testing, pathology, and proficiency testing laboratories, inspection, verification, and certification bodies in all economic sectors, in compliance with the Kenya Accreditation Service Act 2019. This will increase confidence among clients and patients and provide quality referencing testing services from the laboratory. So for us, is that relationship, and we are very glad. We are a very big customer of this institution, and I believe we will continue with that that way. Thank you, Chairman. Thank you, Mheshimiwa, for that. Thank you.
Thank you very much, Mr. Thuku, Deputy Director General NMS. Madam Honorable Senator Mutahi, our Cabinet Secretary, before I invite the PS to make her maiden remarks, allow me to remind you of a specific ask that, as I said, these boys and girls made to me through my office to the PS. And I think they have tried to talk about it. Mary Okeo put it very well, the issue of staffing. And it's our ask as the PS comes to speak up to this, that you note this with and request, sir, that you take it up and see whatever I can do to improve the staffing of these laboratories. Of particular interest is a request that we had made. You've noted, for example, as we went to the HIV lab, a number of qualified staff that we have trained extensively in HIV testing that are, of course, under the Global Fund recruitment. And our ask, therefore, if you could uptake this into the MOH mainstream recruitment system, we'd be more than glad, and it's going to improve our quality of services. So, Madam PS, as you come to go back to the ministry, you're going to put this again to your desk, see how far we can go about with this one. One other issue, of course, that has been ailing this laboratory the reference labs, is the issue of power supply. There are many times that we've had to call your office that I'm not able to release data to you on a weekend because power has gone off. I think we have a perennial power problem in this complex. And there's a request therefore that we have, because NMS is here, Madam PS and CS, if we could handle this power issue once and for all, so that all this equipment leads a stable power supply, we probably would be very happy, and my colleagues in the laboratory will be more than happy. They do not have to repeat testing for the high throughput equipment. When they put all the plates in the equipment, they have to repeat when the system goes down. If you could have a stable power supply in this laboratory, is more than glad. Otherwise, those few remarks, let me invite Madam PS to make her immediate remarks, and invite you, Cabinet Secretary, to make your remarks for this day. Thank you.
Thank you very much. The Cabinet Secretary in the Ministry of Health, Senator Mutahi, my colleague, the Deputy DG, NMS, my colleagues in the Ministry of Health, the Country Director from WHO. We recognize all of you and other development partners that are here with us, and all the staff at MOH and the Fourth Estate. One, I just want to say that, Waziri, I will join Kuria to say this too is my story. I am very proud of what we have been able to do with the National Public Laboratories in the last 1.5 years. There has been great transformation, and it speaks for itself. You also noticed, sir, there's a lot of women in the labs. That is why Numeweka bendera juu, and you're doing a great job. So to all the women, I congratulate you, and to the men too. That's why, sir, this event is very different, as you can see, colorful. It's because there are women who are thinking about the detail of everything here. Sir, there are issues, yes, to do with labs. First, to say that we have really enhanced capabilities here since COVID-19. They say in every challenge there is an opportunity. And one of the opportunities we have had in terms of health system strengthening is having our labs really lifted up. We are now talking about genomic sequencing. We're even adding the capabilities. There is so much that has gone on here. And, sir, during this COVID-19 journey, I don't think there's any department in MOH that I've been more intimate with than labs. And you remember even when we started, when COVID came, me and you were taken literally through what testing looks like, and we became semi-laboratory technologists, or whatever you'd call us. So it has been an intimate journey. I talked to Kiru, there's no week we will not talk, sometimes twice, 3 times a week, and we really have seen the commitment, and we have endeavored to give every possible support that has been needed for the labs. That I know for a fact. If there's one place where you have had my complete time and mind is the national labs, and it's because you've also been very critical in this response and containment measures for COVID-19. Sir, on the matter of staffing, I'm happy to say that we have had, PSC has approved for some recruitment to be done. We are waiting for the formal letter. We have been pleading, we have followed, and we hear that the board approved. So as soon as the letter comes, sir, with your permission, we will prioritize the absorption of the staff that have served the longest here, rather than going out there. We will make that request as well to the Public Service Commission. So with those very few remarks, I want to congratulate the team and take the opportunity to invite you, sir, to come and address all of us. Thank you very much, and let us welcome the Minister. Makofi, 1, 2, 3. Asanteni sana. Karibu.
Asante sana. Thank you very much indeed. May I first start, I know it is normal to start with all protocols observed, but since they have all been observed, may I just say, colleagues, ladies and gentlemen, I recognize the partners, of course, who are here, but more than anything else, I actually want to start backwards and say thank you. I first want to satisfy Dr. Kuria's request which you didn't need to, because I was going to say anyway. because you cannot come to a place like this and see what has been done and see the people who are doing it, understanding that some people used to sleep here on mattresses in this compound, and you don't appreciate. And I have really no words, like you, Daktari, I have no words to thank you good people. I cannot say thank you enough. The only thing I can say to you is that even we as men and women, even if we as men and women do not thank you, I pray that God will reward you. And therefore today, the Ministry of Health marks a joyous moment. Major milestones that have been achieved by the National Public Health Laboratories in the last year. It's not always that I get an opportunity to speak to this matter, and therefore I will spend a little time, if members of the Fourth Estate allow, and my colleagues here allow, and the guests allow. As you are aware, proper diagnosis of diseases remains a key challenge in the provision of proper care to patients globally. Diagnostic data is critical for patient management and for the prevention of diseases. Laboratory investigations are very important for disease surveillance and for control and management of disease. The NPHL, which operates under the Ministry of Health, plays a critical role in healthcare through the provision of reference testing for key diseases and in response to disease outbreaks in the country and in the region. One of the key mandates of NPHL is receiving clinical samples and clinical data from public and private healthcare facilities in Kenya for confirmatory diagnosis. Another role of NPHL is to coordinate allocation and distribution of reagents and other essential commodities to facilities supported by the Ministry of Health. The labs also receive, compile, and disseminate data for public health policy formulation. Ladies and gentlemen, the National Public Health Laboratories is a conglomerate of 8 reference laboratories located in Nairobi and 7 regional public health laboratories located in Malindi, Wajir, Marsabit, Kitale, Eldoret, Busia, and Machakos. The NPHL laboratories located in Nairobi provide reference testing for key diseases such as HIV, TB, cancer, influenza, malaria, microbiology, and other parasitic diseases, as well as analysis of food and water safety. And on this one, I just want to add one item about the free testing that we are doing for private hospitals. And to say that it would be immoral for a private hospital to get free diagnosis from these labs and then charge the patients who are in their hospitals. It is my hope and prayer, therefore, that those hospitals receiving free services from these premises also pass the same free service to Kenyans. The idea is not to enrich the hospitals. The idea is to bring the cost of health care down for families across the country. That's why we do it for free. But if they are going to be charged, then we might as well charge the hospitals. Then they can charge without feeling guilty. But if they are not going to charge, which is what we would want, then it is essential that we keep the service the way it is. A while back, the country did not have the capacity to conduct sophisticated testing. Samples that require specialized testing, such as quantitative PCR tests, had to be shipped abroad for analysis. You will all recall the first cases being sent out of the country. I'm pleased to note that the equipment and skills the NPHL has acquired in the last 4 years has allowed the facility to expand national testing capability and reduce the need for cheap clinical research and surveillance samples. It's gratifying to note that the lab is the leading facility in the region in terms of the volumes of samples analyzed each year for pandemic influenza, cancer, malaria, HIV, and TB. The lab also plays a critical role in analysis of samples for HIV viral load and the analysis for HIV and TB drug resistance. These capabilities were only rudimentary 10 years ago, seeming like only a dream, and now here we are, celebrating significant breakthrough in our capacities. Even more impressive is the fact that the National Influenza Center, which you all visited today, is now an accredited World Health Organization Center of Excellence for influenza surveillance in East and Central Africa. This accreditation allows the ministry to maintain an active surveillance for flu and related influenza-like illness and to submit variant strains to World Health Organization for future considerations in research such as the vaccine development. It is also worth mentioning that it is this accreditation and accumulation of key competencies that allowed the NIC to accurately identify the COVID-19. The first case was actually discovered here in these labs. Ladies and gentlemen, as we all know, the emergence of COVID-19 pandemic has stretched and put our healthcare system under a lot of pressure. Since we identified our first case, the aspects of COVID-19 testing nationally and plays a leading role in the fight against COVID-19 through the provision of quality assurance panels and coordination of allocation and distribution of COVID-19 commodities to various COVID-19 testing labs in the country. The support has allowed Kenya to rapidly increase testing sites from in March of 2020 to 95 sites currently testing for COVID-19 using PCR methods, and another 461 sites testing for COVID-19 using rapid antigen kits. I think even if you are blind, honestly, from 1 to 95 PCR testing facilities, from 0 to 461 rapid testing facilities. Kwani mwananchi anataka nini ingine? Additionally, NPHL also runs the National COVID-19 Data Center. This center plays a critical role in the collation, analysis, and release of daily COVID-19 results. So, for you members, my colleagues and friends from the fourth estate, when you hear all these daily reports that I read because it comes from here. And when you hear of all these statistics that we give you, which are now alive across social media all over the world, it is because of the efficiency of this lab, and what they have been doing in the last 1 year. And I want to thank you. I want to thank you on behalf of all Kenyans, and to say that without you, this job would have been impossible. What I would like to appeal to the members of the media and the fourth estate is really to make Kenyans understand what is happening here, because it's a technical subject and therefore not one that is easy to grasp, and for Kenyans to see what opportunities exist here, and for them to understand where our nation has been put in regional and global standards because of the things that you are seeing happening in these rooms. This is a game changer. This is an event of momentous, it is a monumentous occasion, really. And even if you talk to Juliet from the World Health Organization, and if you ask her how many countries in this region have got the capacity that Kenyans have developed just in the last 15 months, you might be very, very surprised. But more than anything else, this has happened not because of the machines, but because of the people. It is people who make events happen. It is these young men and women who are in those labs. You walked in, you saw them. And when I looked at some of the younger people and their ages as they were doing what they were doing, I was so happy because I knew we have a future. You know, if you went to the lab, if I went to those labs and I saw my age mates all over the place, I would realize we have a problem. Hapo mbeleni kutakuwa na shida kidogo. Lakini vile mimi nimeona na vile tu mimi nyinyi wenyewe umejionea ni kwamba wataalam wengi wa wataalam wale wako hapa katika hizi laboratories, wengi wao sana ni vijana na wasichana. Unamwangalia unaona just brains. Ukimwangalia ukiona vile anafanya hata hana maneno na wewe, taki kusikia sana, umtishi. Yeye ni kazi tu yake anafanya, na utaalamu unamwangalia unaona utaalamu. Kwa hivyo tukiona hivyo tunajivunia sana kuwa Wakenya. Mimi kama mzazi najivunia sana kama mzazi, kwa sababu naona watoto wetu wamechukua usukani wa kuongoza nchi yetu. Msije mkafikiria kuongoza ni kuwa tu waziri. Mwaziri anaweza ingia hiyo lab ajue ni nani ana COVID. Mimi hata mkinipeleka huko mimi nitakimbia tu kwa sababu naogopa virusi. Lakini hao ni watu ambao ni wamesoma. You know, is a part of our investment in education, part of our investment in our children. This is what has resulted to the capability and capacity that Kenya has in terms of these lab capabilities. So, ladies and gentlemen, in order to improve service delivery, 5 out of the 8 national reference labs at NPHL are now fully accredited with various ISO accreditations. And I want to thank you, Juliet, and through you, the World Health Organization, because it is so important. What you have done for us is so important for us. And I believe that the remaining 3 labs will be enrolled for similar accreditation during the financial year 2021-2022, not depending on the availability of funds. We will make the funds available. And the 5 labs were enrolled into 3 ISO categories, which I will give the details to the media through this speech. The Ministry of Health is happy to announce that the achievements of these 3 ISO categories elevates the national public reference laboratories to international standards. Thus, results generated by NPHL are acceptable globally, and NPHL can now serve as a reference laboratory in this region. Why does this matter? It matters because we need to be sure that a positive result in one lab in a part of the country is similar to another in a different part from a different lab. This way, we can be sure about our investments in diagnosis and treatment that follows. Ladies and gentlemen, a year ago, my office initiated major transformations at this lab that started with the creation of the Department of Laboratory Services. In a period where global healthcare systems have been negatively affected by ravages of COVID-19 pandemic, NPHL has managed to achieve major milestones. These achievements warrant celebration not only by the Ministry of Health, but by the citizens and our development partners. I know that many a times you have been wondering what variants we are dealing with for various diseases, and especially COVID-19. I am happy to announce that the department has secured funding amounting to approximately 300 million for establishment of a whole genome sequencing facility at this lab, that you allow the ministry to actively participate in screening and identification of variant strains and strains of concern, not only for COVID-19, but also for other pathogens that include HIV, TB, malaria, influenza, and other neglected tropical diseases. Until now, all sequencing for COVID-19 variants have been done on behalf of the ministry by partners such as EOLI, Kemri Wellcome Trust, CDC, and Water Read Project. So kwa hivyo mseme hiyo. Hii ni maneno kubwa leo. It is a big thing. It's a big issue. The lab has great potential to contribute to biomedical research and in clinical trial studies. It is this basis that I have directed the head of the Department of Laboratory Services through the Office of the Director General for Health to identify critical research areas that NPHL can collaborate with other research institutions such as Kemri, EORI, and other local and international universities to provide bench space and diagnostic capacity that can be used by different collaborators to generate critical data for the derivation of public health policy by the ministry. But I would also like to mention here, and it is good that the lab is also aware, that when we collaborate in clinical trials, when we collaborate with other countries, we must collaborate in the commercialization of any results that comes out of our work. And this has been a great challenge for us. And I have repeated this severally when I'm in these labs. Good people, with all due respect to our partners, I think sometimes you are being cheated. There is no other word I can use to replace cheated. And if somebody has it, if there is another word, and I say this not to me to seem mean, but it's simply to say that it is important that the sweat of our scientists, the sweat of our researchers is recognized. You cannot work with people for 30 years, doing all sorts of trials, discovering all sorts of things with that person, and then 10 years later, you send us the same products that they were discovering, you send us to Kenya to buy. There's something wrong there. Am I the one who is not thinking right, or is there, am I talking to somebody? Yes. Okay. So I just want to propose that NPHL, as you know, now supports statutory bodies, especially the Pharmacy and Poisons Board, and I would urge that you continue to work with those labs in order for us to further ensure that public are tested for various diseases and illnesses across our country. The lab has migrated from a monodisciplinary institution to accommodate other cadres that include laboratory scientists, statisticians, IT staff, and biomedical engineers. And I want to congratulate you for that particular aspect. There's a tendency for us to work tough and to stay within that tough. And that's why, for example, when we have presented the bill in Parliament to expand the areas that boards should belong to, so that there can be fertilization of ideas, fertilization of skills, you will find that there are some people who are resisting that particular. You gain more by listening to somebody else who knows something different than listening to the same person you have listened to. You know, every day, 365 days. If you still haven't learned anything, if you are still waiting to learn something from them, after 365 days of the same thing, you know, there is something slightly wrong. It is important for us to integrate ourselves with different skills so that we can expand our capacity, our commercial capacity, our research capacity, and essentially just how we interact with each other helps us to be more creative than we would otherwise be. So I also want to mention one final thing about the cancer. You know, cancer remains a major challenge in our country. The Ministry of Health is making all efforts to ensure that this lab, National Oncology Reference Laboratory, acquires modern equipment so that we can be able to diagnose cancer properly. I'm happy to note that this laboratory has increased the capacity to analyze cancer samples from 600 samples in 2019 to more than 3,000 in this year. The modern equipment acquired will allow more accurate testing and detection of cancer using molecular methods. The use of molecular markers will allow early detection of cancers, which will in turn improve patient prognosis. I'd like to thank CDC for supporting the continued enhancement of the National Oncology Reference Laboratory as a National Center for Excellence in Cancer Diagnosis. I'd also like to express my gratitude to our research and development partners for supporting NPHL to achieve these milestones. These partners, some of whom who are here, include CDC, and I would really like you to stand, if you don't mind. CDC, watu wa CDC, wapigieni makofi tafadhalini. The World Health Organization, Juliet and your team. Anybody from the World Health Organization, makofi tafadhali. Amref, anybody from Gitai's outfit? Yes, I can see them here. Karibuni sana, karibuni, and thank you so much. Chai, anybody from Chai? Chai? Chai is not here, Bwana Machari and his group. Kenas, I saw Kenas. Yeah, please wapigieni makofi tafadhali. The World Bank, I didn't see anybody from the World Bank, but there are some of our partners. Global Fund have done a substantial amount of work here. USAID, Africa CDC. USAID, oh yeah, USAID is here. Karibuni sana. Thank you so much. Africa CDC, I think it's the same team. Is it? Yes, okay. Kemri, anybody from Kemri? Kilo, you don't want to stand, eh? Okay. He's yours now. Okay. So we thank Kemri nonetheless, you know, for the cooperation that we continue to have with them. We are brothers and sisters. Early, Welcome Trust. Anybody from Welcome Trust? Among many other partners who have helped us so that we achieve what we have achieved. There are also many other foreign nations and embassies who provided financial support with testing commodities to NPHL. Without their support, it would have taken longer for us to achieve these milestones. Special recognition, particular special recognition, go to the lab staff who have worked so hard, as I mentioned earlier, for these achievements to be met. Finally, the milestones achieved by NPHL will not only support the mandates of the Ministry of Health, but will also support provision of better diagnosis and treatment to all citizens in both public and private testing facilities in all counties in the Republic. As we celebrate these achievements, I urge all the players to continue looking for more innovation and better solutions to health for all citizens. By improving our health delivery service, we shall not only be contributing to better health outcomes, but also be actively bringing a smile to people's faces as they walk in and out of our health facilities, aware that we are not doing guesswork with our diagnosis, and also aware that a disease properly diagnosed ensures better and more effective treatment. I thank you all. Vile naweza kuongeza tu kidogo ni kushukuru wale watu wote ambao wanafanya kazi hapa National Public Health Laboratory, kwa sababu wametusaidia sana katika nchi ya Kenya. bila hawa watu na ile kazi wanaendelea kufanya, ni watu wengi sana ambao wangeaga dunia. Lakini hawa watu kwa sababu wanafanya kazi huko nyuma yetu, pahali wako katika manyumba ambao wanafanya research na uchunguzi, ndio sababu Wakenya wengi hawajui kuna kazi kama hii ambayo inafanywa. Lakini kila mtu anajua ya kwamba ukiwa unajisikia kama mgonjwa, unaenda kwa laboratory, yule mtu unamkuta hapo, lab technician, anachukua damu yako ama kitu ingine chochote, anapeleka kwa lab, ndio wale watu wako huko ndani wachunguze, na ndio watueleze shida yako ni shida gani. Kwa hivyo wewe unamuona daktari hapo mbele, unamuona nurse hapo mbele, lakini nyuma yao kuna watu wataalam wa kiasi ya juu sana ambao wanasaidia sisi katika nchi yetu ya Kenya. Na bila hao watu sisi hatuwezi kuwa kama nchi, hatuwezi kutibia wale watu ambao wako na ugonjwa, na ile uchunguzi inaendelea kufanywa ndio itasaidia sisi hata kupata mandawa mengine ya kusaidia wale ambao watakuwa na ugonjwa leo hii na kesho yake. Kwa hivyo mimi ni kuwashukuru tu. Vile vile ningetaka kuwasihi na kuwaomba watu wa magazeti na sana sana watu wa media, wale tunafanya nao, watusaidie na njia ya kueleza wananchi ile kazi ambayo inaendelea hapa. Ndio sababu wakisikia tunataka kuongeza idadi ya wale watu ambao wanafanya kazi hapa, kama PS amesema, tunataka kuandika watu wengi hapa katika wale watu ambao wanafanya hii kazi. Na kuna wengine ambao wamefanya kazi hapa kwa wakati mrefu lakini hawajaliwa kazi. Lakini kutoka sasa, hii ni kazi ambayo tutaendelea kufanya. I want to assure you, those people who are working here, don't lose hope. We are with you all the way. All the way. Na sisi tukisema kitu, sana sana tunasema na tunafanya. Hatusemi alafu tunaiacha, tunasema na tuyafanya. Kwa hivyo mtusaidie, members of the fourth estate, tusaidieni sana kueleza watu ni kazi gani inaendelea hapa. Na hayo machache, na mshukuru sana, niseme asanteni sana na kazi iendelee.
Well, thank you very much, Honorable CS, for those kind remarks. Indeed, very encouraging. It's not yet over. Where I come from, this is like an initiation process. When you grow up, you go through initiation, rites of passage. Sikuna kutahirishwa. And eventually, hiyo inaitwa Kirui anakuwa presented kwa wazazi. Ingeomba initiate leo awe presented kwa waziri. So ningeomba CEO Kenas ukuje hapa mbele to present the initiate, the accreditation that we are talking about, the certificate. Kindly Kenas, we would want to see the initiate presented tujue kweli amekomaa na amekuwa sasa mtu mzima. He's graduated now, it's an adult, so our labs have graduated to a higher level. They are now internationally accredited. So thank you very much, and let us welcome Martin Chesire with a clap on our. Thank you very much, Chesire.
Thank you very much, Dr. Kuria, Waziri, PS, all protocol observed. Allow me to make a citation what this means for the staff and for the laboratory. We have 4 certificates to issue, which are to the international standards of ISO. It demonstrates, now I wrote this down so that I don't forget the words. The citation says, National Public Health Laboratory, all its 5 laboratories have demonstrated through a rigorous assessments that was carried out independently by KENAS, which is a member of the International Laboratory Accreditation Corporation, to have met the requirements of the following 4 standards. ISO 17043, which is on proficiency testing. and that relates to the Kenya External Quality Assurance Scheme for proficiency testing. ISO 17025, the international standard, for both testing and calibration laboratories, and the final one, the ISO 15189, which is for the medical testing laboratories. So what Waziri, the staff have done, the reports from my team demonstrate that they were able to perform effortlessly, and National Public Health becomes our first in Eastern Africa to be accredited on multiple standards. So it's now my honor to present to you, Waziri, in the order of the different accreditations, the accreditation certificates.
What were proficiency testing? This is your day, really. This is your day.
You see, truly Kenyan.
In fact, or you want to do one
by one, so that they know the testing. Okay, Hero, move your laboratory manager to go with this one.
Who is the laboratory manager? Oh, you're here. So here you go. You're going to money.
The second one is the one that you saw for alcohol testing, platoxis. This is the testing laboratory.
Good luck.
And Waziri, it has an international mutual recognition mark.
Lakini watu,
Okay, I think there'll be more photo sessions, so can we have a few teams comply with the spacing? Yeah. The calibration laboratory. Dr. Kiro and your managers, congratulations.
Okay.
And finally, don't give it back to me, otherwise you will lose accreditation. This is the largest for the medical testing laboratory.
Congratulations.
Congratulations.
Asante sana. Very well. Appreciate it.
And with that, sir, for the interest of time, I would request that we proceed to the quality assurance accreditation service.
Let's do the...
So they can officially launch the center, sir. Thank you.
Where is it?
Located within the Kenyatta National Hospital.
Where is our mic? But I hope it's about ice.
No, it's on COVID. You know, Waziri, when we get you here, we have to ask you on COVID. Yeah. So I have 3 questions. The first one, I've met a number of families.
Yes.
So, Bwana Waziri, I have met a number of families whose loved ones... Okay. My name is Zainab Mohammed from TV47. I have 3 questions. Number 1, I have met a number of families whose loved ones have died due to COVID-19, and their bodies are being detained in hospital due to pending bills. This is not in one county, it's in several counties. So my question is it even okay for a hospital to detain a deceased person's body that they specifically know that the cause of death was COVID-19? Is the ministry aware of this, and what is your comment on that? Number 2, now that politicians are doing rallies, matatus are carrying full capacity and we're seeing a declining positivity rate. This is a concern for Kenyans. Is it time to lift the curfew? Then finally, Mashujaa Day is a week away. and we are still at 4 million vaccinations. Are we really going to meet the 5.8 million target by next week with issues of vaccine hesitancy coming up? Thank you.
Okay. Asante sana. There are no other questions? You know, if you are going to eat a toad, you might also eat a fat and juicy one. So if there is other questions, it's fine, but otherwise I'll respond to the ones that you have asked. On the issue of people being detained in hospitals, it is illegal. It is actually illegal to detain anybody, a deceased person, in a hospital. It doesn't matter why. It doesn't matter whether the person is a result of money, is a result of whatever else might be, but you cannot detain a dead person in a hospital. It is cruel. It is punishing the family. Nobody wants to keep their loved ones in a mortuary if they can avoid it. Therefore, it is clear that this is not something that should be happening. And we will take steps. If you continue to hold COVID-19 patients, COVID-19 dead persons in your lab, knowing very well that we have said the period that a body must be buried within, then you run the risk of your license being withdrawn for your mortuary or your hospital. So I would persuade that those practicing that illegal practice to desist from doing so and to immediately comply with the law, because there is a law to that effect. The second one, on the issue of curfew, nothing would please the government better than to lift the curfew and other restrictions that are there. But just because the positivity rate has come down a bit, it does not mean that we are out of the woods yet. And what I can say is that, yes, we are at 4.3 million people in terms of vaccinations. This will go up. We are confident that even if we don't get to the 5.8 million that we are targeting, we will still be very, very far up there. We have a lot of cases. We have a lot of data come back to us yet. On even have been diagnosed in various counties. So we are confident that even our current figures are higher than that. It is those figures, it is the increase in that figure that will help us to lift the curfew and go back to normal. Essentially, the issue of vaccinations is what is going to make Kenya free again. And my last one on that one is when you're talking about the uptick of vaccines. We don't have a problem with, I don't know where this notion that we have a problem with the uptick of vaccines is coming from. You ask me that question all the time, and I answer the same answer all the time. My problem is not the people who are refusing to take vaccines. My problem is the people who want vaccines and can't get them. That's a very different problem. Kwa sababu, you know, when wewe ukitaka chanjo na hupati, hiyo sasa inakuwa ni kazi yangu. That's now my job. You know, if you can't get it, it's my job. Ukikataa, hiyo sio kazi yangu. Hiyo sio kazi yangu. Wajua unaweza peleka ng'ombe mtoni ikunywe maji. Sasa hiyo ng'ombe ikikataa kunywa maji, utaifanya nini? Wewe utakunywa maji, utaikunywa maji barara hiyo ng'ombe. Kwa hivyo mimi nasema wazi, shida yangu ni wale watu ambao wanataka chanjo na hawapati kwa sababu haijawafikia, lakini itamfikia. Kama wewe unataka chanjo utapata, na ukipata chanjo umejikinga. Kwa hivyo mimi ni kuwasihi wananchi, go for the vaccine whenever it is coming, and I'm happy that some counties have already rolled out mobile vaccinations, and we have seen a very high uptick in some counties. Nairobi, for example, has already had 30% of people of the vaccines that we have actually deployed, and 30% of Nairobi population have at least got one dose. At least one dose. The second county that is very good is Nyeri County, 25%. of them have received at least a dose. There are some other counties like Uasin Gishu who are very high. Kisumu is also up there in terms of the ones who are high. And then there are some other counties with 1.5%. Even as Nairobi is at 30, Nyeri at 25, others over 20. There are some others that are at 1.5. What does it depend on? It depends on the ability of the county government to work with the Ministry of Health to ensure that the vaccines are reaching people, to ensure that people are going to vaccination centers, and also to communicate and tell people it is dangerous not to have been vaccinated. So I think it is the onus falls on wananchi. Wananchi waulize magavana, CECs wa health katika zile counties ambazo zina 1.5%. Na tutapatia media. We will give you those results so that you can publish the first county, the best counties, and the worst counties. Ikiwa worst county, sio mimi nasema. It is the statistics that are there. And you can't start making excuses and saying that, oh, in this county, we don't have this and we don't have the other. Every county has exactly the same things. It's a question of efficiency. It is a question of commitment. It's a question of dedication. And it's a question of realization that you want to save those people in those counties. So I think I have answered your question comprehensively. Asanteni sana.
We can... Check on two.
Public Health Laboratory Services, NPHL. Division under the Ministry of Health, it is mandated to perform diagnostic testing, reference testing, disease surveillance, among others.
So the National Public Health Labs is actually only one of our divisions. We have a department, the Department of Laboratory Services, and this has two divisions. We have the National Public Health Labs, which we are going to refer as now, and then we have the division of diagnostic and clinical support. So the NPHLS, the reason why it's laboratories and not laboratory, because we have many labs.